Addiction is a complex disease that affects the brain and body. It is characterized by compulsive drug seeking and use, despite harmful consequences. Addiction can impact anyone regardless of age, background, or social status. The consequences of addiction are far-reaching, affecting not just the individual but also their loved ones. Families and friends often find themselves caught in a web of emotions, trying to cope with the addict's behavior and its impact on their lives. They may experience feelings of anger, frustration, guilt, and helplessness. The strain of addiction can lead to broken relationships, financial instability, and emotional distress for everyone involved. It is important to remember that addiction is not a choice but a treatable disease. With the right support and treatment, recovery is possible. Understanding the difference between helping and enabling is crucial in supporting a loved one struggling with addiction. Enabling and helping are often confused, but understanding the difference is crucial in supporting a loved one struggling with addiction. Enabling refers to behaviors that protect the addict from the consequences of their actions. While it may be done out of love and concern, enabling ultimately perpetuates the addiction cycle. Helping, on the other hand, empowers the individual to take responsibility for their actions and seek recovery. Enabling behaviors often stem from a desire to fix the situation or shield the addict from pain. However, by doing so, enablers inadvertently allow the addiction to continue, preventing the addict from hitting rock bottom and realizing the need for change. Helping, on the other hand, involves setting healthy boundaries, encouraging accountability, and supporting the addict in seeking professional help. This approach may be more challenging in the short term, as it requires the addict to face the consequences of their actions. However, it is essential for their long-term recovery. Enabling behavior, while often motivated by good intentions, can have devastating consequences for both the addict and the enabler. By shielding the addict from the negative repercussions of their actions, enabling allows the addiction to spiral out of control. The addict may continue to engage in risky behavior, knowing that someone will always be there to clean up the mess. Moreover, enabling can lead to resentment and burnout in the enabler. Constantly rescuing the addict can take a toll on their emotional and physical well-being, creating a toxic cycle of codependency. It's important to recognize that enabling does not help the addict in the long run. In fact, it often exacerbates the problem by allowing the addiction to flourish without consequences. To truly support a loved one struggling with addiction, it's crucial to shift from enabling to helping. Distinguishing between enabling and helping behaviors can be challenging. Here are some practical examples to illustrate the difference. Giving the addict money that they will likely use to fuel their addiction. Making excuses for the addict's behavior to their employer, friends, or family. Covering up or minimizing the consequences of the addict's actions. Encouraging the addict to seek professional help and offering to support them in the process. Setting healthy boundaries and refusing to engage in behaviors that enable the addiction. Providing emotional support and encouragement while holding the addict accountable for their actions. Remember, true help empowers the addict to take responsibility for their recovery, while enabling perpetuates the cycle of addiction. By understanding these differences, we can better support our loved ones in their journey to sobriety. Supporting a loved one's recovery from addiction requires a delicate balance of compassion, firmness, and understanding. Here are some tips on how to provide support without enabling. Learn about addiction as a disease. Understanding the biological, psychological, and social factors that contribute to addiction can help you approach your loved one with empathy and avoid judgment. Clearly communicate your limits and what you are and are not willing to do. This might involve refusing to lend money, make excuses, or tolerate disrespectful behavior. Support your loved one in seeking professional treatment, such as therapy, counseling, or support groups. Offer to attend appointments with them or help them research treatment options. Remember that recovery is a journey, not a destination. There will be setbacks and challenges along the way. Your unwavering love and support can make all the difference in helping your loved one achieve lasting sobriety. Addiction is a complex disease that often requires professional intervention. Seeking help from qualified healthcare professionals is crucial for successful recovery. Treatment options may include individual therapy, group therapy, and family therapy can help individuals address the underlying causes of their addiction, develop coping mechanisms, and repair damaged relationships. Medications can be used to manage withdrawal symptoms, reduce cravings, and prevent relapse. Support groups like Alcoholics Anonymous, AA, and Narcotics Anonymous, NA, provide a safe and supportive environment for individuals in recovery to connect with others who understand their struggles. If you or someone you love is struggling with addiction, please know that you are not alone. Reach out to a healthcare professional, addiction specialist, or a trusted friend or family member. Recovery is possible with the right support and treatment.